Constipation might not be the most exciting presentation to come to the emergency department, but it can be one of the most satisfying to get right. Here are 5 tips on how I manage constipation in the ED. Tip 1, take a good history. This part is so important because to identify that the child's constipated, you do need more than they're just not able to poo today or they haven't pooed for a few days. You need to know what's been going on in the past. So you want to go right back to the beginning, when they were born, did they pass meconium in the first day or 2? And then you want to get a general impression of what their stool pattern is like, not just today, but certainly over the last number of months. So frequency, how often do they poo? Is it 5 times a day? Is it once a week? And how has that changed over the last few months? You want to know consistency. So what does the stool look like? Is it hard? Is it runny? Because you can have constipation but still have some runny stools from overflow. This is where it's time to get your Bristol stool chart out. You need to show it to the family and ask them what the poos look like. Ask about volume. Are they passing small pellets or are they having large volumes of massive stools? Ask if the child strains a lot or spends a lot of time on the toilet, and these questions are going to slightly vary depending on the age. Ask if they've seen any blood or mucus, or if the child has soiling where they can see that they've had some diarrhea or staining in their underwear. Ask about any medications they've used, what they've tried before, and particularly how long they've tried it for, because any medication, any treatment in constipation can't be a short-term thing. It's going to take a while to sort it out. And ask about fluid intake and diet in general, as this is the key thing that has an impact on constipation in young children. Tip 2, watch out for the red flags. Constipation is really common, but make sure we don't get overly focused on being certain it's constipation. We need to have an open mind to other conditions that might be causing these symptoms, so look out for the red flags. Red flags are going to include not passing meconium in the first day or 2, or constipation that they've always had since they were a very young baby. This can be an indicator of Hirschsprung's. Weakness in the legs, sacroagenesis, any dimples or hair tufts or skin changes over the spine, any deformity of the lower limbs or neuromuscular or neurological signs would clearly be a red flag, because you shouldn't be finding them in routine constipation. Also have a think about how acute the presentation is, so could it be a surgical obstruction rather than constipation? In constipation, it's going to be an ongoing history. It's not likely to be something that's just started that day. So make sure you keep an open mind. Don't be closed off to the idea that it has to be constipation, because you may miss something important. Tip 3, in children over 1 year old, use polyethylene glycol as your first line treatment for constipation. The way this works is that it basically absorbs more water from the body into the poo, so it makes the poo softer and easier to pass. We use Movicol in the UK. It doesn't contain any electrolytes, it just adds more water to the stools, so you really can't go wrong with it. This is our first choice treatment in children over 1 year old, and we usually use a disimpaction regime to get started. I'll share a link under the video to where you can find the disimpaction regime, but essentially there will be a different regime depending on the age of the child, but you build up the number of Movicol sachets that you take each day or every 2 days until you get to the peak, which might be 12 sachets. It will depend on the age of the child. Although this seems like a lot of sachets, what you're trying to do is flush everything out. So you should be getting essentially brown water being passed. The thing that you need to advise parents of are that they might have more soiling at the time because you're trying to get them to a stage where you flushed everything out and they'll have lots of runny poo. It might give them some abdominal discomfort because things are going to be getting moving, and that might cause them a bit of discomfort. And that they're going to see a lot of poo. So what's coming out when they're constipated seems like there's very little, but that's because there's a huge backlog of poo, hard poo in the abdomen, and when we're disimpacting them, we're trying to get that all to flush out. And just reassure them that Movicol or another PEG doesn't cause any harm to the child. It is literally just absorbing more water into their poo. And reassure them that using 12 sachets a day or whatever you've advised is actually perfectly safe for the child. The biggest challenge parents are going to have is actually persisting and managing to get their child to take the number of sachets that you've recommended, because it doesn't taste nice. Parents should mix the granules into a drink, and I would suggest trying different drinks to see what their child prefers. Putting it in water is probably not going to taste that nice. They can try it in different juices or squash and see what their child prefers, but it is difficult, and we need to emphasize that persistence is the key. Even though it's difficult doing this at home, it's actually really important that families keep going with it. There's no point in just doing it for a couple of days and then stopping. Once they've reached disimpaction, they've reached the max sachets for a few days and they've had all that brown water coming out, then it's time to rein it back and work out what their maintenance dose of Movicol is going to be. Their maintenance dose might be a few sachets a day, but they need to ensure they persist and take this every day. Tip 4. In young babies or newborns, think about whether what you're seeing is actually just normal variation in stool. Newborns can hugely vary in how many stools they pass a day. Some newborns will pass 7 stools a day. Some might go 7 days without passing a poo, and both versions may be normal. It depends on lots of other factors. Is the baby doing well? Is the baby feeding well, growing? Does the baby look well? Do you have any other concerns? So the fact that the newborn hasn't pooed for a few days in itself doesn't necessarily mean you need to jump in with treatment. In this age group, you should be using lactulose as your first line treatment rather than PEG. But before you do that, have a think about whether it's really necessary. And in infants under 1, it's not very common that they present with constipation. So if you're seeing a kind of 6 to 12 month old with constipation, really have a think about whether there's something else going on. And tip 5, make sure you give parents good advice when you send them home. You should be giving parents general advice for managing their toddlers with constipation, which will include making sure they drink plenty of fluids, making sure they have a balanced diet. We can also give parents general advice on how to manage toileting for their toddlers. That might include making sure that after each meal and before bedtime, they go and sit on the toilet for 15-20 minutes. This is the most natural time when they're likely to pass a stool, so it's a good time to try this. They can also make sure that they're sitting in a good position on the toilet, so you can put a box under their feet to have their feet slightly raised and make sure that they're comfortable. Another good technique is having distraction tools there in the bathroom so that you can keep your child on the toilet to make it more fun so that they can relax and sit there and enjoy rather than desperately trying to get off the toilet. So these are all pieces of advice that we can give to families when they go home. And my bonus tips are: don't do abdo x-rays in toddlers presenting with constipation. These should only be requested when you're worried about another condition and you've spoken to a specialty. It shouldn't be part of your routine diagnosis of constipation. And the other tip is that you shouldn't be doing PR examinations in children with constipation. The only time that a PR exam will be being done in this scenario should be by a surgeon when you're worried that there's a surgical cause of the constipation. Please comment below and let us know what other tips you have for managing constipation when it presents to Paeds ED.